afternoon, Miss. I am 𝙈𝙧𝙾 𝙆𝓚, BSN 2A student of St. Anthony's College. And today, I'm going to perform wound care. First, we're going to review the medical orders for wound care or the nursing plan of care related to wound care. Next, we're going to gather the necessary supplies and bring them to the bedside stand or over bed table. And then, I'm going to perform hand hygiene and put on PPE if indicated. In my case, I'm going to put on apron. Now, we're going to identify the patient. So, ma'am, good morning. May I know your name and your date of birth, please?
I am Nelly Balyarta, March 15, 1963.
Ma'am Nelly, ilang taon ko lang inward wristband. Okay, ma'am Nelly, I'm going to provide your privacy by making sure to close the curtains around bed and to close door to room if possible. And ma'am, today I'm going to change your dressing, clean your wound in order to promote wound healing. Now, we're going to assess the patient for possible need for non-pharmacologic pain-reducing interventions or analgesic medication before wound care dressing change. Administer appropriate prescribed analgesic and allow enough time for analgesic to achieve its effectiveness. May ginabatsyag ko nga sakit sa imong nga pilas dyan, ma'am?
Mura man.
Oh, okay. I'm going to place a waste receptacle or bag at a convenient location for use during the procedure. And I'm going to adjust bed to comfortable working height, usually elbow height of the caregiver. Next, I am going to assess the patient to a comfortable position and use the bath blanket to cover any exposed area other than the wound. And now, I'm going to place a waterproof pad under the wound site. And we're going to check the position of drains, tubes, or other adjuncts before removing the dressing. Now, we're going to put on clean disposable gloves. And we're going to loosen tape on the old dressing. If necessary, we can also use adhesive remover to help get the tape off. Next, we're going to carefully remove the soiled dressing. So if there is resistance, we can also use a silicone-based adhesive remover to help remove the tape. And if any part of the dressing sticks to the underlying skin, we can also use small amounts of sterile saline to help loosen and remove it. After that, we're going to note the presence, amount, type, color, and odor of any drainage on the dressing. So, our patient's wound is 3 cm, serous type, pale yellow color, and no odor. Now, we're going to place the soiled dressing in the appropriate waste receptacle, and we're going to remove my gloves and dispose it in the waste receptacle. Now, we're going to inspect the wound site for size, appearance, and draining. And we're going to assess if pain is present. May ginabatsyag ko nga sakit sa imong nga pilas dyan, ma'am?
Mura man.
Now, using sterile technique, we're going to prepare a sterile work area and open the needed supplies. Now, we're going to open the sterile cleaning solution, and depending on the amount of the cleaning needed, the solution might be poured directly over gauze sponges, over a container for small cleaning jobs, or into a basin for more complex or larger cleaning. And we're going to put on sterile gloves. Now, we're going to clean the wound. So, we're going to clean the wound from top to bottom and from the center to outside. Following this pattern, we're going to use new gauze for each wipe and placing the used gauze in the waste receptacle. Or, alternately, we can spray the wound from top to bottom with commercially prepared wound cleanser. Once the wound is clean, we're going to dry the area using a gauze sponge in the same manner. We can also apply ointment or perform other treatments as ordered. If a drain is in use at the wound location, clean around the drain. Now, we're going to apply a layer of dry sterile dressing over the wound. Forceps can be used to apply the dressing. And we're going to place the second layer of gauze over the wound site. You can apply a surgical or abdominal pad over the gauze at the site as the outermost layer of the dressing. Now, we can remove and discard gloves. And we're going to apply tape to secure the dressing. After securing the dressing, we're going to label dressing with date and time. So, we're going to write December 3, 2021 at 1 p.m. Now, we're going to remove all equipment, place the patient in comfortable position, with side rails up and bed in the lowest position. And we're going to remove our PPE if it is used, or we're going to remove our apron. And lastly, perform hand hygiene. Now, we're going to check all wound dressings every shift. More frequent checks may be needed if the wound is more complex or dressings become saturated quickly. And lastly, we're going to document the procedure. That would be all. I am Mary Christine 𝙆𝓚, BSN 2A student of St. Anthony's College. Thank you.